Every 40 seconds, a stroke affects someone in the world. It is a sobering statistic for a health crisis that can alter a life in an instant, leaving many to feel that such a devastating event is beyond their control. This fear is understandable, as stroke remains a leading cause of death and long-term disability worldwide. However, this narrative of helplessness may not be complete. What if it were possible to draw upon the power of nature, using wisdom cultivated for centuries and now being explored by modern science, to actively support your brain and vascular health? Welcome. Today our focus is not simply on risk factors, but on proactive measures. We will explore 6 notable herbs, backed by a growing body of scientific research, that may help build a stronger defense for your cardiovascular system. This information is not a replacement for conventional medicine, but rather a way to empower you with knowledge to supplement your health journey. We will examine how these natural allies can function within your body to address inflammation, support blood flow, and protect brain cells. You will learn not only what they are, but how they are believed to work, and the scientific evidence that makes them a subject of interest. This is about turning apprehension into focused, positive action. If you are ready to take a more active role in your brain health, you are in the right place. Our first herb is likely one you have heard of, ginkgo biloba. Often called a living fossil, the ginkgo tree has existed for over 200 million years, and its leaves have been a cornerstone of traditional Chinese medicine for an equally long time. Its reputation is not merely built on ancient history. It is now being rigorously tested in modern laboratories and clinical settings for its role in brain health and circulation. How does this ancient plant contribute to the modern understanding of stroke risk? Its benefits appear to lie in a powerful combination of antioxidant and anti-inflammatory compounds. A stroke often occurs when a clot blocks blood flow to the brain, an ischemic stroke, or when a vessel bursts, a hemorrhagic stroke. Ginkgo biloba appears to work in several ways to support smooth blood flow. First, ginkgo is known to support blood circulation by helping to dilate blood vessels, which may allow blood to move more freely. It also has an antiplatelet effect, meaning it can make blood less sticky. Platelets are small blood cells that form clots to stop bleeding, which is beneficial for an external injury. However, when platelets become overactive inside arteries, they can form dangerous clots. Ginkgo may help moderate this process. The scientific evidence is compelling. A 2024 study presented at the American Stroke Association's International Stroke Conference found that patients treated with an intravenous form of ginkgo's active components after a clot-caused stroke showed better cognitive recovery at both 14 and 90 days compared to those who received a placebo. While IV preparations are used in China for stroke treatment, more research is needed to confirm these effects for oral supplements. Still, the research points towards ginkgo's neuroprotective capabilities. It acts as a free radical scavenger, neutralizing harmful molecules that cause oxidative stress, a key driver of cell damage in the brain during a stroke. As with any powerful herb, caution is essential. Because of its effect on blood clotting, ginkgo biloba should never be taken with blood-thinning medications like warfarin or aspirin without strict medical supervision. It is a potent tool that must be used wisely and in consultation with a healthcare professional. Next is an herb that has rightfully earned the title of golden spice, turmeric. For thousands of years, this vibrant yellow root has been a staple in Ayurvedic medicine and Asian cuisine. Its value extends far beyond the kitchen. The primary active compound in turmeric, curcumin, is one of the most powerful natural anti-inflammatory agents discovered, and its potential to support vascular health is a major area of scientific interest. To understand why curcumin is so beneficial, it is helpful to revisit a root cause of stroke. Many strokes are the end result of atherosclerosis, a condition where plaque builds up in the arteries, narrowing them and making them less flexible. This process is fundamentally driven by inflammation. Chronic low-grade inflammation can damage the lining of blood vessels, creating a surface where cholesterol and other substances can form plaques. This is where curcumin may function as a master regulator. Research has shown that curcumin works on multiple pathways to protect the vascular system. It directly inhibits key inflammatory molecules, such as NF-kappa B, which acts as a master switch for the inflammatory response. By reducing chronic inflammation, curcumin helps protect the integrity of arterial walls. Additionally, curcumin is a potent antioxidant that neutralizes damaging free radicals and boosts the body's own antioxidant enzymes. The scientific evidence supporting curcumin is robust. Preclinical studies on animal models of stroke have been quite promising. Some human studies have demonstrated that curcumin can improve the function of the endothelium, the delicate inner lining of our blood vessels. A healthy endothelium is crucial for regulating blood pressure and preventing clot formation. Other trials have shown curcumin can help lower LDL, bad cholesterol, and triglycerides while boosting HDL, good cholesterol, directly targeting the components of arterial plaque. A long-standing challenge with curcumin is its bioavailability, how much is absorbed and used by the body. On its own, curcumin is not easily absorbed. For this reason, curcumin supplements are often formulated with black pepper extract, piperine, or with phospholipids to enhance absorption. While adding turmeric to food is a healthy habit, for a therapeutic effect, a high-quality bioavailable supplement is often recommended. As always, this is a conversation to have with your healthcare provider, especially since high doses of curcumin can have blood-thinning effects. Our third herb, Panax no ginseng, may be less familiar in the West, but in traditional Chinese medicine, it is a legendary remedy known as sanqi. For centuries, it has been revered for its ability to manage bleeding, invigorate blood, and treat cardiovascular ailments. Today, modern science is working to confirm these traditional uses, revealing its protective effects on the brain and blood vessels. The primary active components of Panax no ginseng are a unique group of saponins, including ginsenosides RB1 and RG1. These saponins are the driving force behind the herb's benefits for circulation. Their action is multifaceted, addressing several key risk factors. Research in China has shown that Panax no ginseng can improve cerebral blood supply, which may help reduce brain damage caused by ischemia, the lack of blood flow and the most common type of stroke. Consider it a support system for your vascular highways. It helps maintain vessel health through strong anti-inflammatory effects and has antiplatelet properties, helping to prevent the abnormal blood clots that can trigger a stroke. The evidence for Panax no ginseng is growing. It has been used regularly in China as part of stroke treatment protocols. A large, multi-center, randomized, and placebo-controlled trial called the XPECT trial was designed to rigorously assess the efficacy and safety of Panax no ginseng saponins, PNS, for patients with acute ischemic stroke, highlighting the serious medical interest in this herb. A 2024 meta-analysis suggested that Panax no ginseng injections may provide short-term benefits in improving neurological deficits for stroke patients. While many of the most robust studies use an injectable form, oral supplements of Panax no ginseng are available. It is a powerful herb that should be used with professional guidance. Given its effects on blood circulation, it is essential to consult with a healthcare professional, such as an integrative doctor or a licensed practitioner of Chinese medicine, before incorporating it into your regimen, especially if you have a bleeding disorder or are taking anticoagulant medications. If you are finding this information valuable, please take a moment to like this video and subscribe to the channel. Our goal is to bring you research-backed, actionable health information, and your support helps us reach more people who are looking to take control of their well-being. Remember to select the notification bell so you do not miss future updates. Now, let's continue with our fourth herb. Our fourth herb is Gotu kola, also known as Centella asiatica. Revered in both Ayurvedic and traditional Chinese medicine, it is often called the herb of longevity and is regarded as a brain tonic. While other herbs on our list focus primarily on the vascular side of stroke risk, Gotu kola's strength lies in its neuroprotective and even neuroregenerative properties. It may not only help protect the brain from injury, but also support its healing process. The active compounds in Gotu kola, triterpenoids, are believed to be responsible for its brain-supporting effects. Research suggests that Gotu kola may stimulate neurogenesis, the growth of new brain cells, and encourage the branching of neurons that allows them to communicate. This is significant, as it suggests the herb could play a role in enhancing cognitive resilience and recovery. The scientific community has taken a keen interest in Gotu kola. Animal studies have demonstrated its neuroprotective effects quite clearly. Human trials have focused more on cognitive improvement after a stroke. One study compared Gotu kola extract to folic acid for improving post-stroke cognitive impairment. The results showed that Gotu kola was just as effective as folic acid in improving overall cognitive function. Impressively, Gotu kola was found to be more effective than folic acid in the specific domain of delayed memory recall. Gotu kola is generally considered safe and well tolerated. It is available in various forms, including capsules, powders, and teas. Unlike some of the other herbs on our list, it is not known for strong blood-thinning properties, making it a potentially safer option for a wider range of people. However, the principle of consulting a healthcare practitioner still applies. They can help you determine if Gotu kola is appropriate for your individual health profile and guide you on proper dosage. For anyone looking to support their brain's cognitive function and resilience, Gotu Kola is an exceptional natural ally to consider. The fifth herb on our list is hawthorn, a thorny shrub whose leaves, flowers, and berries have been used for centuries in Europe as a premier heart tonic. Its connection to stroke risk is direct and powerful because the health of your heart and blood vessels is inextricably linked to your risk of stroke. High blood pressure, high cholesterol, and poor circulation are all major risk factors, and hawthorn may address all three. Hawthorn is rich in powerful antioxidant compounds that support the entire cardiovascular system. One of its most well-documented effects is on blood pressure. Scientific studies show it acts as a natural vasodilator, meaning it helps relax and widen constricted blood vessels. This allows blood to flow with less force, reducing strain on artery walls and lowering blood pressure. This is crucial, as hypertension is the single largest modifiable risk factor for stroke. Beyond blood pressure, hawthorn may also help manage cholesterol and prevent the formation of atherosclerotic plaques. Animal studies have shown that hawthorn extract can lower total cholesterol, LDL cholesterol, and triglyceride levels. Some research suggests it helps stabilize existing plaques. Unstable plaques are dangerous because they can rupture, triggering a large clot that can cause a stroke. By promoting plaque stability, hawthorn may help mitigate this risk. The evidence for hawthorn is extensive, particularly regarding heart failure and cardiovascular health. Numerous clinical trials have validated its use for these conditions. While direct research on hawthorn for primary stroke prevention is still emerging, its mechanisms are clearly aligned with reducing stroke risk. An animal study on an experimental stroke model found that pre-treatment with hawthorn extract had beneficial anti-inflammatory effects, suggesting it could reduce stroke-related damage. Hawthorn is available as capsules, liquid extracts, and teas. It is generally considered safe, but because of its powerful effects on the heart, it can interact with cardiovascular medications, including beta blockers and drugs for heart failure like digoxin. Therefore, it is imperative that you speak with your doctor before taking hawthorn, especially if you have an existing heart condition or are on prescription medications. Our final herb, Astragalus membranaceus, is another giant from traditional Chinese medicine. Known as Huang Qi, it is celebrated as a superior tonic for boosting qi, or vital life force. For thousands of years, it has been used to strengthen the body against disease and enhance energy. Researchers are now discovering its potent protective effects against cerebral ischemia, the lack of blood flow that causes the most common type of stroke. The power of astragalus lies in its complex array of active compounds, including polysaccharides, flavonoids, and saponins. These compounds give it powerful antioxidant, anti-inflammatory, and immune-modulating properties. Regarding stroke risk, astragalus appears to work by protecting the brain and its delicate blood vessels from the cascade of damage that occurs during an ischemic event. One key way astragalus offers protection is by mitigating what is known as ischemia-reperfusion injury. This is the paradoxical damage that occurs when blood flow is suddenly restored to an area of the brain deprived of oxygen. This sudden rush can trigger a massive wave of inflammation and free radicals. Studies have shown that astragalus can help calm this process, suppress neuronal damage, and reduce inflammation. Research has shown that astragalus can improve neurological function and reduce the infarct size in animal models of stroke. The scientific evidence is building a strong case for astragalus's neuroprotective capabilities. A 2023 study found that a combination of astragalus extract and ligustrazine from another Chinese herb conferred significant neuroprotective properties against cerebral ischemia-reperfusion injury. Another study highlighted that astragaloside 4, a key component, can alleviate stroke-triggered brain injury by modulating neuroinflammation. Its anti-inflammatory role is particularly noteworthy. Astragalus is typically consumed as a decoction, in soups, or as a standardized extract. It is considered an adaptogen, helping the body adapt to stress, and is generally regarded as very safe for long-term use. While it does not have the strong blood-thinning effects of herbs like ginkgo, its immune-modulating properties mean that individuals with autoimmune conditions should consult their healthcare provider before use. A conversation with a knowledgeable practitioner is the best first step. We have now reviewed 6 powerful herbs, each offering a unique and scientifically supported approach to supporting brain and vascular health. Ginkgo biloba, turmeric, Panax notoginseng, Gotu kola, hawthorn, and astragalus. The central message is one of empowerment through knowledge. While no single herb is a panacea, incorporating these natural allies into a holistic health strategy, one that includes a healthy diet, regular exercise, and stress management can create a powerful synergy. It is about shifting from a place of fear to one of proactive, informed self-care. It is critical to remember that this information is for educational purposes and is not a substitute for professional medical advice. Please do not start or stop any treatment or supplement without first consulting with a qualified healthcare professional. This is especially important if you are pregnant, nursing, have a pre-existing medical condition, or are taking any prescription medications, particularly blood thinners or heart medications. These herbs are potent and must be used responsibly. Thank you for investing this time in your health. We hope you found this information helpful. Have you used any of these herbs? Share your thoughts and experiences in the comments below. If you have not already, please like this video, subscribe to the channel, and turn on notifications to join us for our next exploration of natural health. Until next time, be well.